I appreciate my colleague, Mr. Farr, bringing this forward. I agree with what he said except for one item, and that is that somehow medical marijuana is intensely controversial. What we're finding is that with the American public, it's no longer really that controversial. As he said, 20 jurisdictions, 19 states and the District of Columbia, have approved medical marijuana to be available to their citizens. Over 1 million Americans are people who are legally entitled to have the qualities of medical marijuana. And it's long been recognized that it has therapeutic values. They use it to deal with chronic paralyzing pain, the nausea associated with chemotherapy, symptoms of multiple sclerosis. There are many applications that are going to make a difference to our veterans dealing with traumatic brain injury or PTSD. Now, it is ironic that when we're trying to have a veterans health system that deals with the total patient, and this committee just supported an amendment that I had earlier to help give them alternative therapies, that we would prohibit a VA doctor from even discussing a therapy that is perfectly legal in 20 jurisdictions. What is the rationale here to prohibit the doctor from being able to have that conversation, forcing our veterans to go outside the system, incur additional costs? I think it is a misguided policy in the extreme. We're in the process now where the majority of Americans think that marijuana should be legalized. And if you ask the question, should we respect the decisions of states, that majority gets even bigger. Over 60% say the federal government ought not to interfere. But here, the Veterans Administration is prohibited from giving candid advice to people in our system, people who could benefit, like the over 1 million legal medical marijuana patients. I think that's inappropriate. I think it's unfortunate. I think we should do everything we can to try and relieve the pain and suffering that our veterans are incurring. And if it means having a conversation with a VA doctor about something perfectly legal in their community, I think that's the least we could do. I commend the gentleman for bringing the amendment forward, and I hope that the day will come when we provide this service to veterans who would like information about it. Thank you, Mr. Chairman, and I yield back.